Well, welcome back. Two very common complaints about pain, headaches and back pain.
Yeah, I've had both. They can keep you from enjoying work and life. Dr. Eric Stananis and Dr. Maria Fensky are here from ProHealth Chiropractic Center with symptoms, self-care, and treatments for headaches and back pain too. Great to see both of you.
Well, thanks for having us.
I would imagine it's got to be close to 100% of Americans at some time or another have had both of those types of pain, but for some people it can be chronic too.
Absolutely, yeah. A lot of people experience headaches and back pain. We're here to chit-chat a little bit and guys give some information about each one of them.
It's
All
great.
right, let's talk about headaches first, because those are the ones, I mean, for me, the back pain really hurts, but that headache that just constantly stays there. What are your patients telling you about what they're feeling, and what do you think is the real, the reason why?
Mm-hmm.
So most people with headaches, as you said, we've pretty much all experienced a headache. The good thing to know about headaches is the majority of them are not caused by a brain tumor or extreme high blood pressure. Most headaches really become cervicogenic headaches, or headaches that come from neck stress, upper back stress. And they're the type of things that kind of wrap around to your head. You start feeling them here, you start feeling them here. They're brought on by stress. The greatest part of it is that the majority of headaches have a musculoskeletal component to it. And so they can be addressed by chiropractic adjustments to have some release in the musculature, some correct alignment of the spine, and having the neck work at its optimum and not give other symptoms.
In terms of symptoms, the pain can be in different places, right? Through the temples, it can be in the front of the head, the back of the head, a lot of people complain about. But then you can also have radiating pain down your neck and some of the places that you talked about.
Correct, yes. So the majority of people say they start feeling kind of a band type of symptom here, and it can be unilateral, bilateral. It can wrap all the way around. Sometimes it can feel like a band around your forehead. Some people just complain about stress and just tension in through the upper back, and then eventually it becomes a headache.
Mm-hmm. So what do you do to figure out what their particular pain is and how you can adjust it?
Well, we figure out if it's a headache that we can address, and if we do, there's usually a component in the cervical spine or in the thoracic spine, and if that is the case and can benefit from chiropractic care, we would adjust that area and kind of retrain those joints to move properly so that there's less and less stress on those segments.
Are there some things we can be doing in terms of self-care to alleviate some of the pain of headaches?
Yes, so things like posture, when our mom told us to sit up straight or stand up straight.
Now you're making me think
right.
about it. I know, all of a sudden Molly got
So when we're sitting, trying to make sure that we're in a correct posture, having our ear over a shoulder, shoulder over a hip, having a computer monitor that is at correct eye level so that you're not looking up or looking down too much. The use of a cell phone and trying to hold the phone up properly so that you're not torquing your neck, holding it in different positions, in straining the neck, all things that we can do at home. Even the use of a small towel to put behind the neck when we lay down and try to encourage a normal lordosis in the neck would all be helpful.
Mm-hmm. Okay, how about drinking water? If I tell my kid, like every time he has a problem, like, are you dehydrated?
Exactly.
Does that come into self-care?
Yes, all of things. So proper nutrition, decreasing the level of stress, staying hydrated, all of that will help with keeping headache symptoms down.
How about your back pain too?
Yeah.
Yes.
Yeah, so back pain again is very prevalent out there, right? 80% of the population will have back pain at some point in their life, okay? Back pain is kind of a broad term, and today we're going to just kind of highlight three kind of diagnoses that people here might have, and we'll just give them a little bit more information. The first one is...
And you brought props, I love that.
Yes, we got a couple props. Some of the words that we use are a little hard to explain with words, so we'll use a picture here. The first one is a disc bulge or a disc herniation, okay? So your spine has kind of a jelly donut in between the vertebra, okay? A disc bulge is when this kind of bubbles out a little bit, and it can crack, it can cause some irritation, it can be extremely painful. And then what can happen as well is it can irritate the nerve that's really close, which then can cause some leg pain with that. Now the main thing with this is, even though it's an extremely painful condition, it is something that's going to resolve through conservative means, okay? It's not necessarily you need surgery the next day if you have a diagnosis of a disc bulge, disc herniation. It takes time, it's painful, but you can get through it through chiropractic. Again, the chiropractic adjustment and the treatments that we use aren't going to push the disc back into its place, but what we're going to do is we're going to create an area around the vertebra that is more relaxed, more conducive to healing, so your body can heal properly.
What's the other type of back pain?
So the other one a term that people hear is stenosis. Okay, so stenosis is a big word that means narrowing, and kind of a classic sign of stenosis. If you're pushing your grocery cart in the grocery store and you feel better leaning forward, okay, that's going to open up the spine a little bit and allow the pressure off the nervous system and reduce some of the pain. Now, how we get stenosis is through another term that often we hear is called degenerative disc disease, and that's when you can see that this is a healthy disc and vertebra, and this one is not, okay? So as you start to lose your disc height, and again, posture, right, is going to cause some pressure
That's
down.
self-care.
You know, we want to make sure that the disc is healthy, but if it starts to become unhealthy, the bones are actually going to start to come closer together. We're going to have some
That
change.
rubbing there. We're running out of time. Tell
Yeah.
us real quickly about this last one.
So the last one, again, is just kind of a variation of some of the stenosis. But the main thing that we want to talk to people about today is self-care back prevention, right? So it's cold out, you're shoveling, all those different things. Make sure that you guys warm up a little bit, do some knee bends in the house. And again, when you're shoveling, make sure that if you move your nose, move your toes. So your body's turning, not twisting, okay? That's going to take some of the shear force off the disc and prevent a major injury.
I've never heard that
is-
before. I
haven't
like
either.
that.
Nice new information.
You
right
guys
here.
do complimentary consultations, which is wonderful. People can schedule that. If you've got headache or back pain, call the people at Pro Health. So here's the information for Pro Health Chiropractic Center. It's 262-242-5577 in Mequon and Thiensville. Then you have a location in Random Lake, 920-994-2000. ProHealthCC.com is the website to visit again. Thank you both so much. We appreciate it.
Thank you
Thank
for
you.
having us.
And we'll be right back.